Welcome back. Well, as coronavirus cases continue to mount across India, there's a new threat, and that is of asymptomatic cases that's come to the fore. The Health Ministry has, in fact, revealed that 80% of positive cases are asymptomatic or show only mild symptoms. The revelation came to the fore after Chief Ministers of Maharashtra and Delhi said that there were a high number of asymptomatic cases in the worst two hit states. Now, in fact, the ICMR has termed the rise in asymptomatic cases as a challenge. However, it said that India cannot go for mass testing due to the large population, the financial implications, and also the clear infrastructural issues. Remember, the total number of coronavirus cases in India have crossed the 18,000 mark now.
Around 80% cases या तो एसिम्प्टोमेटिक या माइल्ड सिम्टम्स के साथ पाए जाते हैं। जो वर्ल्ड वाइड हम लोगों ने इसको एनालिसिस किया है, अराउंड 15% केसेस हैं जो सीवियर केसेस में कन्वर्ट होते हैं, जिनको हो सकता है कि ऑक्सीजन सपोर्ट की जरूरत पड़े, और 5% केसेस जो होते हैं वो क्रिटिकल केसेस में कन्वर्ट होने के चांसेस होते हैं।
Let's get you an update coming in from Mumbai on this. Divyesh is joining us with the latest updates. Divyesh, at this point, the state of Maharashtra is facing so many challenges in overcoming the corona. The city of Mumbai, you've got a spread in slums. You've got several journalists who also tested positive. With the fact that several of these people who are testing positive are asymptomatic, what is the government strategy to tackle that? Are they planning a lot more testing?
Yes, Akshita, the key to detecting more and more cases, more and more positive cases and containing the community spread depends on more and more testing. So, testing is being carried out at various outlets, various centers across Mumbai. Also, there are several organizations which have tied up with the Health Ministry of Maharashtra who have arranged for camps. Such testing camps have been arranged in Eastern Mumbai today as well. There is a testing camp in Thane as well, where several media personnel and other persons will be tested. So there is huge demand for more and more testing to happen, so that the positive cases could be contained, could be treated, and the community spread could be contained further. As we see what is happening in Dharavi and areas like Govandi, it becomes a Herculean task for authorities like BMC and the health department to contain the spread. The numbers have already crossed 3,000 in Mumbai, while the total number of cases, positive cases in Maharashtra is now 4,666, out of which the 466 cases were reported in last 24 hours and 308 cases out of this were from Mumbai. So Mumbai remains a huge hotspot. The various areas which have been declared as containment zones, areas have been sealed. People have been requested to stay indoors. And now that the 53 journalists, who were mostly all of them were asymptomatic, it becomes a bigger issue for BMC and health department to tackle this, tackle containment of COVID-19 and its spread in various other areas. So key to this remains that more and more testing needs to be done. People who are asymptomatic or are exposed need to be tested. Akshita.
Okay, Divyesh, thank you for joining us with all those details. As Divyesh tells us really what the government strategy is, let's get you the latest numbers that's coming in from Maharashtra. We are seeing, of course, that the number of coronavirus cases has now crossed the 4,000 mark in the state. Now, Maharashtra has reported 466 new cases on Monday and 9 deaths. Mumbai remains the worst affected city with more than 3,000 cases so far. The financial capital has reported 308 new cases and 7 deaths on Monday. Meanwhile, the State Health Minister Rajesh Tope has said that the government will go for 75,000 rapid tests as soon as the centre gives conditional permission to the state for the same. He said that the government has also decided to use hydroxychloroquine drug as a precautionary measure in areas like Dharavi, where there has been a COVID-19 spread. The centre, meanwhile, has constituted 2 interministerial central teams for Maharashtra to, in fact, make on-spot assessment of the situation and issue necessary directives to state authorities over how to combat coronavirus. And in the national capital, there's also a coronavirus scare at the Rashtrapati Bhavan as family members of at least, in fact, 125 houses in the Rashtrapati Bhavan premises have been asked to isolate themselves after a staffer's relative tested positive for the novel coronavirus. One sanitation worker's daughter-in-law's mother had died of COVID-19. The sanitation worker and her family attended the funeral of the deceased patient. Now, the daughter-in-law, who's not an employee but stays in the complex, has also tested positive. Out of the 125 families kept in isolation, 25 are in fact under strict watch as they share the same block as that of the patient.
A COVID positive case has been reported inside the presidential complex, a high secure zone in the national capital. Right behind me is the President House, where a sanitization worker's relative have been tested positive. However, all the direct contacts of the positive case were tested negative, but now, since she is not even the worker or the employee of the presidential house or in the complex, but all the family members, including the 25 families and those houses in the same block, have been gone under complete isolation, strict isolation. However, as a precautionary measure, 125 other houses are under isolation inside the presidential complex. At the same time, the Delhi government has also begun rapid testing provided by the centre government. Those kits, rapid testing is being done in the hotspot. But now the concern is growing, and particularly when the cases are even reaching the high secure zone like President House complex after one positive case of sanitization workers relative have been diagnosed. For now, in the national capital, with Sanjay Kumar, this is Ashutosh Mishra for India Today.
Let's also get you the overall picture of what's happening in the national capital. Delhi continues to battle the coronavirus pandemic. The capital has in fact reported almost over 70 new cases and 2 deaths in the last 24 hours, taking the total number of cases to 2,003. And 45 deaths, unfortunately, have also been confirmed. As the number of cases continue to rise, the Delhi government has increased the number of containment zones in the capital to 84. Traffic on the Delhi-Ghaziabad route has also been stopped owing to the rise in the number of cases. 5 Delhi police officers from Chandni Mahal police station tested positive for coronavirus, taking the total number of infections in police officers to 8 in the capital. This comes as the Delhi government has in fact started rapid testing in coronavirus hotspots. The Delhi State Cancer Institute, that was shut after 27 of its staff tested positive for the virus, has now slowly resumed its operations. In a major success also, a critical virus patient who was on ventilator recovered after plasma therapy. This was at Saket's Max Hospital. Now, at this time, when states and the central government are expected to work in tandem and work together, once again, there's a political tussle playing out in West Bengal between the Mamata Banerjee government and the centre. In a letter penned to Prime Minister Modi, West Bengal Chief Minister Mamata has slammed the government's decision to send 2 interministerial central teams to West Bengal. Mamata alleged that the central government team entered Kolkata without any intimation, calling it a breach of protocol. She also said that she would not be able to move ahead on the interministerial teams unless Prime Minister Modi and Home Minister Amit Shah share the criteria used for this decision to send the teams to Bengal. BJP has hit back, saying that the Mamata government is hiding data on COVID-19 deaths in Bengal and has failed to test enough people, and hence the TMC government is scared of details coming out. The centre has constituted 6 interministerial central teams to make an on-spot assessment of the COVID-19 situation.
She is actually disrespecting the federal structure by thinking that the centre is going to just be a mute spectator to everything that is coming out in the public domain about the apathy of the health condition and health status in West Bengal, and how she has created bureaucratic firewalls through which medical reports, death reports needs to pass through for the people to know whether a death has really been a COVID death or not. So she's unnecessarily making this a political issue. I think rather than that, she should use this as an opportunity to gain the faith of the people back.
Indrajit Kundu is joining us live from Kolkata with the latest on the story. Indrajit, considering that these ministerial teams have been sent across the country, in Bengal there are already 2 teams present. Now, has Mamata indicated that the government will not cooperate with these central teams?
Well, absolutely. If you look at the show and terror of the letter that the Mamata government has sent to Delhi yesterday, it clearly shows that there is a sense of cooperation as far as the state government is concerned, because Mamata Banerjee maintains that the spirit of federalism has been broken by this.
Okay, Indrajit, we'll come back to you. A bit of a problem with your audio. Apologies to our viewers. We will get back to Indrajit in just a bit. But what we know at this point is that there are two teams, interministerial teams in Kolkata. The Mamata government has said that they will not cooperate with these teams. Mamata Banerjee has also written to Prime Minister Modi on this. Breaking news that's coming in.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.